Welcome to a presentation on the use of the GigaSystem for the purposes of helping hospital operations. There is a difference between knowing and understanding. And if understanding is brought into processes, such as the processes that are used in the operation of a hospital or a health system, then there's an opportunity to make better decisions. And these better decisions hopefully result in better patient outcomes, better efficiency of resources, increased revenue, decreased cost. Knowing is not enough. Understanding and right judgment is the goal. In this example, we're going to follow Dick Devlin, someone involved in the operations of a health system or a hospital, and look at the use of the system to create a repository of understanding, mountains of understanding behind every process involved in hospital operations. Some other features, though, of this platform, before we dive into the mountains of understanding, include messaging, video sharing, posting, podcast, short vids. All of these modes on a private digital services platform. Let's get into it. Again, what we're looking at is this repository, these mountains of understanding that can be created internally or with external partners or with vendors or with whomever in order to help bring focus on the operations behind each of these. And these are the typical type of departments that one would find in a hospital. And now we're going to dive down into outpatient clinics. And here what we have an example of someone taking the time to do the deep dive on pulmonary care. The whole idea here is for an operations person to come in and to see pulmonary care assessed from multiple viewpoints, drawing upon human opinion, analytics out of EHR systems and databases, and AI. What we see here is that there has been a contribution by Dick Devlin. And this contribution is a completion of the GigaIntelligence rubric, an 11-step detailed assessment that leads to understanding from one person, or could be AI, point of view on a specific topic, and in this case, pulmonary care. So let's take a look at the actual assessment. Here is the 11-step process of performing and reading a detailed intelligence assessment that contributes to understanding. And here we have the context, which is pulmonary care at an outpatient clinic. The perspective is that of Dick Devlin, Chief Operations Officer, who has both a physician's background and a hospital operations background. It's very important to understand a common care practice where this is done often, and one is very interested in outcomes, quality, revenue, and cost. What's the wisdom? Is that pulmonary care practices need to be driven by understanding. Instead of being driven by data, instead of being driven by AI, where technology drives humans. In the GigaSystem, humans drive technology because humans are after gaining understanding, which leads to intelligence and right judgment, better decision making. What's the insight? The insight here is about the relationship of this pulmonary care assessment in multiple dimensions. In essence, there's It's about understanding and constantly learning and improving this practice of pulmonary care. And by doing it for pulmonary care, one can do it for the other processes in the other parts of the hospital or health system practice. Here, what we're saying is that there's some knowledge behind why are we doing this. And here we have a contrived statement. 98% of the time a healthcare practice is evaluated and monitored using Giga Healthcare platform. Outcomes go up, revenue goes up, and costs go down. In this assessment, here's where we get to bring in any type of analytics. Links to databases, import of spreadsheets, identification of reports. This is all the analytics that are in support of this assessment. Now we're at a point of looking at the actual process of pulmonary care. And now we're going to look at two views. One view is a Petri net. And here is the actual pulmonary care process. And this becomes our model. This is what should happen. And at each of these transition points, P in this explanation, is an opportunity for a decision to be made in all these transitions, from actual decisions to outcomes. And what we're asserting here is that behind every one of these decisions is an opportunity to introduce and base that decision upon understanding. And understanding is more than knowing. It brings into that decision these these other levels. So at the point of making a decision in that pulmonary care process, all of these levels are being addressed in all the dimensions, such as medical recommendation, compliance, insurance, etc. Everything that one would want to understand at every point in that process is now coming from this database of understanding. And the other points about this is that pulmonary care can actually work with AI, in that the risk of there's a low risk that this pulmonary care process is too rigid to actually be useful, and the opportunities to commit oneself to really looking at an organization and its actual implementation of pulmonary care and figure out why is it that there might be a difference between what should be and what is. So this again is an example of how there can be these mountains of understanding built about specific business processes, showing here a schematic and a flow, and then using that flow to actually have behind it the understanding at every point in the process, with decisions being made and events occurring, to build up the actual experience of pulmonary care, and to compare it back to the reference model, whatever model that is, as to how pulmonary care should be conducted. So Giga is able to take together the human, the analytic, and the AI and bring it in and make it something useful to the operations manager. Let's go back here for a moment and then look at one more aspect. How are these actually created? We're going to actually look at the creation of an assessment. I want to bring out a point. Here is the assessment for the current or the recommendation within this repository as to what should be done. What I want to call your attention to is this right here. At this point where someone is creating this mountain of understanding from their perspective, one could have access to AI engines and analytics and easily bring those into the context of the assessment, making the actual assessment easier to create. That concludes the use of the Giga platform for helping the operations people at a hospital and health system.